Some of you have listened for a long time know that we've kind of done a series of the different types of services from the University of Missouri Healthcare, and we're going to talk about one today that I don't remember the last time that we ever had this as a topic. It's probably been many, many years, probably even decades, that we've talked about reproduction capabilities, infertility, and what the University of Missouri has to offer for that. I don't think we've ever talked about. Dr. Shvetha Zarek is in the studio with me. It's nice to meet you. How are you?
I'm doing very well. Thanks for having me.
So let's introduce listeners to the topic and tell why this is something that healthcare facilities like MU Healthcare even offer.
Well, it's an incredibly important kind of journey for patients to go through. And really, more than anything, there's 1 in 8 couples that are affected by fertility in one way or another. And if you think about it, that is a lot of people.
It is.
Yeah. And so, part of what we do is really more patient education in terms of learning about how this affects folks, what kind of options that they have. And I view kind of what we do as the very first kind of consultation is just talking through so they feel empowered in terms of what are next steps, because it is a pretty personal process and no one expects to have a doctor kind of as part of that.
It is a personal, very personal. When you're talking about this, is it too simple to just say it's the inability for a couple to get pregnant?
Actually, that is the perfect definition. So the ASRM definition is the inability to conceive after about 12 months or a year.
And that would be because I've read some things that were online, and I think this is posted actually on the website, but it's talking about advice for whether you need to go to somebody for help or for consultation. It depends on what your age is.
It does, very much so. So, the way kind of fertility medicine has come together is that we usually actually end up seeing the female partner. And I'm a gynecologist by training and then subspecialized in fertility medicine. And I think there is a little bit more kind of testing for the woman there, but does not necessarily mean at all that that is actually the factor. So it is very much so. We try very hard to make sure that we encompass both the male and female partner, because very much so that is what affecting infertility.
I don't know how long you've been in the practice of doing this, but I'm going to sense it's not a really long time. You look young, but my question is related to the history of this. Are people more aware of this now than they used to be? Is it more of a problem now? Was it something that maybe 40 or 50 years ago that just wasn't talked about?
That's a great question. So I've been doing this for over 10 years now. I look a little bit younger than I actually am. And that quick answer is that actually fertility numbers have stayed the same, or infertility numbers have stayed the same. The difference is that there is a little bit more in delayed childbearing in women. And so we're seeing couples a little bit more, but it's only because they're coming to us later in life.
So what is the risk in delaying starting a family?
What we know most about fertility in general is that it's age-related to the woman, which is part of why we say if you are 35 years and above, come after trying for about 6 months. And if you're close to 40, which is really when fertility starts to really take a nosedive, and that has a lot to do with egg quality, come in immediately.
So how much of what you do with the women and with the couples who come in is also being kind of like a psychologist or a psychiatrist? Because to me, it seems like especially, I think there's that element in almost all healthcare, but in this, I think that you really have to be concerned with the moods and the feelings and the thoughts that are going on with the couple.
Very much so. And it's done in a very respectful way. And we end up being a support system because it is somewhat of a difficult process. We very much so on purpose call it a journey because there is steps along the way. And some folks feel like there's 1 step forward and 2 steps back. So just to be a coach more than anything. And the nice thing is that after doing this for more than a couple years, I have anecdotes that I can tell them. I was in this scenario with another couple. We made it through. Don't worry about it. We will get there.
What's the is it success rate? Is that the right term to ask? So what is and a success would be a healthy pregnancy that leads to a baby.
Yeah, that's absolutely right. So more and more we're moving towards talking about success, not as pregnancy, but a healthy live birth. There's 2 different types of treatment that we do. One is intrauterine insemination, where we essentially take a sperm sample and we put it into the woman, into the uterus. Very quick, easy to do. I talk about it as a low technology kind of way to start fertility treatment. And we see generally a success rate around 10 to 20% if you try that about 3 times. It's not amazing. However, it's an easy place to start. And so our next kind of treatment is very different. That's the in vitro fertilization, which is kind of what I specialize in. And I was brought to MU Healthcare to kind of help build that here. And that has much higher success rates. We're talking more like 65 to 75%. So
have the costs gone down on that? Because I've read the news stories over the years what people were having to pay or willing to pay to be able to go through in vitro.
The cost has not gone down. It also has not gone up very much. However, I think more and more as more doctors, educators, providers, patients, families talk through this treatment, there's more companies that are covering IVF as part of medical insurance. And that's really the goal.
You know of research that's still going on or anything else that might be like the next major breakthrough in treating infertility? Is there anything else out there that you could imagine?
There is actually quite a bit. There's kind of two different arms to it. One is looking at male infertility because we're learning that that's more and more where a lot of kind of where we haven't achieved success is. And also it's looking at the egg and also trying to actually boost the health of the eggs that are there.
Is there, you're dealing with the practical, the clinician side of this. So the next question may be one that you say, oh, I don't have any idea, nor do I care because it's not important more for what you do every day. But are researchers finding that there is like a environmental impact on this? Is there something that's happening in our lifestyle now that is impacting male infertility or female infertility? Are they tying it up with plastics in our world or any other thing like that?
It is very much so. So they're finding more and more there are environmental toxicants, things like BPA, which we find, and even like receipts that we handle, just going to the store have those and can affect essentially hormone, kind of disrupt hormones for women. So that we're more seeing it in women than men. But however, the things that we talk about in an initial consultation are really simple. And that actually what affects both egg and sperm health quite a bit. Exercise, good nutrition.
The basics that always has to do with your health.
Yeah.
But there are still, true or false, there is still a percentage of male and female who will not be able to reproduce. Is that just a fact of life?
That is right. And that's a pretty small percentage. And the nice thing is we have many different methods that kind of help them achieve parenthood. And you know, we work very hard to make sure when we meet a couple that we talk through all the different options. Family building means that we talk about adoption as well. Now, that's not necessarily my training in my wheelhouse, but I've learned a lot about it because that's something I really have to offer couples if they're interested in it.
From the start to the finish of something that would be typical or average, what's the process? What's the length of the process? When you first have a couple come to you and say, they're a young couple, we've been trying for a year or 15 or 18 months, and we have not been able to conceive. From that point on, about how much time, what are you looking at?
It really varies. For some folks, they come in, they decide they're going to do treatment right away, and they start right away, and they're successful on that first try, and they're done within 4 months, let's say. Other folks, I think this next part is a little bit more normal, is that, you know, they try a little bit more on the graduated treatments. That first one I talked about, IUI, is only about a 10 to 20% success rate. Then they move to the in vitro. That usually takes about a year. And so, you know, just kind of moving through that process. So
here's my question that if you haven't heard this, I'm going to really be surprised, and I'll buy everybody dinner. But how many times have you heard, either through persons who have come to you and said, we are having trouble getting pregnant, but a friend of mine said, well, we were also, and once we started the adoption process or once we stopped worrying about it, then I got pregnant. I mean, people say that all the time.
They say that all the time, and it happens all the time. And so, you know,
but is that a mental thing?
It may not be, you know, so let's say they started fertility treatment for one reason or another, they didn't finish it. You know, there's something about priming the system that we may have done to get them ready for it. And then lo and behold, it happened naturally, which is the best way. I mean, that makes me so happy when I have someone who, you know, maybe we tweaked something minor for them and then we get the message from them. And I got one just the other day, you know, that they're pregnant. I love babies, so.
I don't need to buy dinner because you've heard that. People have said, well, once I stopped trying, then all of a sudden I got pregnant. And that's a common thing. All right, before we end, tell those who are on the other side who've said, well, gosh, what she's talking about, I've never had difficulty with that. But tell them why it's important and why you feel that it's important for you to do what you do.
You know, because so much of this is so personal and everyone has their support person, and you listening out there may be that support person for your friend, your cousin, your sister, your brother. And so just kind of learning a little bit about what we do and explaining that process. Hey, I had a friend that went through this is so helpful because it just kind of opens the door to say, it's okay to talk about this personal kind of journey with a doctor. They are going to understand and they're going to support you and care for you. And ultimately, we get to say that they are able to conceive. It's very cool for me at MU Healthcare to be able to see someone who's conceived, and then we get to see the baby when they deliver with us, Not necessarily, but sometimes.
Well, it's just one of those things that's for some people, you don't think about the heartbreak that is a background of those who haven't been able to have a child for whatever reason, or maybe they don't go through the treatments, or they go through and they're among the 80% in that first treatment that you mentioned, or the 35% in the in vitro fertilization that don't have success. I mean, there are people out there who really would love to have kids and would make great parents, and it's just not happened the natural way for them. Mm-hmm. So let's see, you have a reproductive medicine and infertility. Is that like something that somebody would call up MU Healthcare and say, could you tell me more about this? And they'd get them in touch with you, or what's the process?
That's exactly how it works. So, they call the number. Our admin staff is wonderful and understands this journey very much so, and helps kind of talk through where we have 4 doctors on our team. Myself, Dr. Zarek, I'm kind of do a lot of IVF procedures, as well as Dr. Albert Sue. Our division director is Daniel Schust, and he's a recurrent pregnancy loss specialist. We didn't kind of touch on that too much, but those are folks that a lot of times don't have trouble conceiving, but then end up having a number of miscarriages.
I see.
And so he takes care of them. And then our 4th doctor is Dr. Keller Tracy, and she's wonderful.
I see that right now. What I did was I went to the MU Healthcare website, which was muhealth.org, and I typed in the search reproductive. You can put in reproductive medicine and infertility, and it'll pop right up, and you'll see the contact number as well as referrals, and well as the information and the pictures of the doctors. I think it's been a fascinating conversation. Thank you so much for coming in this morning. She is Dr. Shvetha Zarek, who is with the reproductive medicine and fertility at MU Healthcare. And this is News Talk 1400 KFRU. It's news time. We'll go to the KFRU newsroom.